COVID-19 for healthcare professionals. My name is Nicole Ammon. I am going to be your facilitator, and I'm a clinical assistant professor of psychiatry at NEOMED and manager of integrated healthcare initiatives. So the way that this session is going to run today is a little bit different than a typical ECHO session. Typically in ECHO, we would have everybody participate throughout the whole thing by muting and unmuting themselves. We would introduce everyone, but I see we're at 239, so we're going to limit verbal introductions to our folks on the panel. We will have a brief didactic, and then we've got some time for cases, for questions. Just to note that the entire session will be recorded and will be available online within the next few days, along with the slides that are used. And if you have questions during the presentation or afterwards, we ask that you use the chat box for those. Alternatively, if the chat box presents any kind of an issue, you can send your questions to neomedecho@neomed.edu. So neomedecho@neomed.edu. And we will try to monitor questions throughout there too. We don't have continuing education. That was a question for a lot of our participants last time, but we normally do have continuing education. So if you're interested in our other programs, we do offer CE for those sessions. So without further ado, we're going to introduce our panel, starting with Jen Dougall.
Good morning, everyone. I'm the director for the Center for Student Wellness and Counseling Services and at Northeast Ohio Medical University. I oversee the counseling program for our medical and pharmacy and research students.
Thank you. And Sarah Dougall?
Good afternoon, everybody. My name is Sarah Dougall. I'm a mental health pharmacist and associate professor in the Department of Pharmacy Practice at NEOMED.
Thanks, Sarah. And Doug Smith.
All right, good afternoon. I'm a psychiatrist and a forensic psychiatrist at the Summit County Alcohol, Drug Addiction, Mental Health Services Board, and also currently the interim chair of psychiatry at NEOMED.
Thank you. So for any tech issues throughout the session, again, you can use the chat box for those too, or you can reach out to Jamie Brewer, Emily Murphy, or Kay Seibert. They're all available in the chat, or you can connect to them by email. But at this point, I'm going to mute myself and let Jen take over for our slides and a brief didactic.
Okay, thank you, Nicole. Well, I'm first going to get my screen shared here. Let's make sure I pick the right one. Can everyone see this okay? Right, okay. Well, thank you for this opportunity today to speak to you regarding stress, as we navigate this whole new world of dealing with an infectious outbreak with COVID-19. So today I'm going to really hone in on how this is impacting healthcare workers and healthcare professionals, and to teach them skills regarding methods of coping. I'm going to first overview the definition of stress and the different types of stress reaction and the stages that come with that, and specifically talk about healthcare and disaster responders, the signs and symptoms of excessive stress and burnout that tend to happen with this population. And even though I'm specifically addressing the aspect of healthcare professionals and burnout and stress, it doesn't mean that others who are listening in today cannot benefit from this discussion. I will also, probably what everybody's waiting for, is overview the aspects of coping strategies to how to manage stress more effectively. At Northeast Ohio Medical University, my team in the Counseling Center has derived several skill areas that we feel are foundational in for developing the education of our students going into healthcare profession, but these are things that come from very sound clinical practices. We call them master skills, and we'll be talking about those different areas. And lastly, I'll give you lots of resources for you to connect to regarding healthcare professions burnout, information regarding that, as well as links to help improve those things. So stay tuned for that. Okay, so let's take a look at the different types of stress. I'm going to make an adjustment here because I feel like I don't want to turn off everybody, but I want ambient sound here. Okay, I feel like I was operating in a tunnel. Okay, so taking a look here, there are three primary types of unhealthy kinds of stress. So there is a type of stress that is good. It's called eustress. That's the kind of stress you feel like when you show up at a surprise party for you and you're shocked and amazed, or it brings you great joy. So that's exciting. It does elevate your body, and that's a good kind of stress. But what we're talking about today are the unhealthy forms of stress. So very basically, stress in general, when we look at the unhealthy forms, starts with acute stress. That's where you may have something impact you for a moment. For students, it could be studying, taking an exam, working with patients. It could be, working with a crash cart, moving in, doing what you need to do. So it's short term, it's very intense, but it disappears quickly. And it often stems from demands and pressures of the recent past or anticipated demands of the future. Episodic stress is a combination or linked up forms of acute stress happening. So you may have a break from it, but then it happens again. So they're frequent bouts of acute stress, taking on more responsibilities than one can handle. Then chronic stress is the area where it starts to become long-term. Emotional pressure is suffered over a prolonged period of time, and there is a perception for someone going through that there is just a feeling of little or no control. And it has a long-term impact on one's body. So taking a look at the different areas of 5 stages of stress reaction. Many of you are probably aware of the fight or flight syndrome. When a stressor hits you, you're going to react, your body's going to react, and that's the sympathetic nervous system getting activated. And what it's actually doing is moving cortisol and adrenaline is secreted to increase blood pressure, your respiratory rate, and heart rate, and it helps the circulation to your muscles, your heart, and your brain, because those are the things that you would normally need to get moving and going if you're confronted with some form of stress or circumstance. And it shuts the blood away from the digestive tract and other organs of the body. Then you get into the next stage of damage control, what we also know as rest and digest. That's when the parasympathetic nervous system starts to get activated, where the vagus nerve helps to decrease the blood pressure, decrease the respiratory rate and heart rate, and bring things back down to normal, while increasing the blood supply back to the gastrointestinal areas and reproductive organs. That's where we'd want to get, right? So that's when things start to de-escalate. However, when we get to recovery, that's when the source of a stressor is alleviated. So if I was confronted with a bear, I'd have a fight or flight response, and the bear goes away, and I get back down to rest and digest. But what we know is that stress doesn't always go away. So the next stage is adaptation. So the source of stress isn't going to go, that we have to come to a point where we have to accept and make adaptations to what is confronting us. So you can't go over it, you can't go under it, you just got to work with it. So that leads us to the final stage of stress reaction, which is burnout. And that's where we're going to get more specific about our healthcare population for individuals working in there, because that is where there is chronic stress that is felt. There's no alleviation and no adaptation that is felt. And the primary cornerstones of burnout, the characteristics and signs and symptoms that go with that, are the points of emotional exhaustion, the feeling of apathy or depersonalization, and feelings of inefficacy. So feeling like you're working really hard, but for what? Because you're not seeing the benefits of that. This is just a slide to kind of, again, reiterate what's happening to the body when you have that stress reaction. Okay. So what does this mean for our healthcare and disaster responders? So prior to COVID-19, we have been dealing with, it's been very well known that our healthcare professionals have been confronted with significant issues related to burnout, depression, anxiety, post-traumatic stress. And in fact, the National Academy of Medicine has become a really good hub of research that's focused in on healthcare professionals and the impact that their work is having on them. So in just this slide alone, one can see that the physical physician rates of depression remain alarmingly high at 39%. 23 to 31% of nurses are experiencing emotional exhaustion in primary care environments, and 24% of ICU nurses are experiencing post-traumatic stress. In addition, there's also pharmacists, and forgive me, I haven't been able to go through all the professions in this stress and burnout, that's relative, but I think if you find in healthcare, there's a lot, and it just goes right down the line. Mental health professionals as well. With pharmacists, they found a high level of state anxiety and stress, high level of burnout, and also confronted with substance use disorders as well. And that's relative to all healthcare professionals, that they're susceptible to those things, or vulnerable rather. So with a healthcare professional on just a regular basis, without anything else going on, they're dealing with just the chaotic environment of the hospital and the practices that they're working in, feeling a low sense of control of the pace that's coming at them, and having to deal with the issues confronting and related to electronic healthcare records and management, and really feeling a time pressure. Not to mention that's work stuff, right? Then there's also the family responsibilities and the stressors that they experience. So we have our daily stresses we go through in our work experience, but we also have a population that's already experiencing elevated forms of stress. So now we take a look at just general symptoms of stress as it impacts you. So we have trouble concentrating, headaches, anxiety, anger, irritability, stomach problems, fatigue, decreased sex drive, skin irritations, muscle tension, teeth grinding, apathy, all of those things I mentioned before. But when we get into burnout, it gets at a higher level. So then this happened, right? So then COVID-19 came in, and now we're adding a whole nother layer of stress to our healthcare professionals. They're already managing an already chaotic environment in their family responsibilities. And now their world is getting turned upside down on how to manage the uncertainty of what's going to be coming their way in triaging these cases. So we're seeing new adjustments in equipment needed. Hospitals are reorganizing their efforts to distribute patient populations certain avenues. And then you can see in this lower right-hand corner the experience of the healthcare professional moving into going home from work and experiencing, just trying to take off her clothes, get the germs and what have you. So there's that fear that what I'm working with on a daily basis could impact my family in a negative way. So just to normalize, what's happening is healthcare workers and disaster responders are vulnerable to what we call secondary traumatic stress because of the cumulative stress that they're experiencing. Now, everyone reacts to stress differently, but common reactions for healthcare workers and anyone under those kinds of pressures can include feeling overwhelmed and helpless to alleviate the pain of others. That comes specific with patient care. Feeling like you can't take a break, that what I'm doing is really important. These people, my patients' needs are more important than me taking that break. And we see a tendency to cut out leisure activities because I just don't have time for that, right? That philosophy. And the fear and worry about one's own health and the health of loved ones. And then we get into the common stress components of changes in sleep or eating patterns, difficulty sleeping or concentrating, the worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs, strong negative feelings, difficulty thinking clearly, problematic or risky behaviors, and social conflicts. So that's the whole kit and caboodle. And I just want to take a moment to pause here because this is really where I want to normalize what is going on with, our healthcare professionals and the stressors that they're experiencing. Because I find too often actually, sitting in the position of being a mental health professional, hearing that folks really think that this is just relative to them. And I think that speaks to a lot of how we've been trained in healthcare, a lot of those areas that we think patient comes first, that we can't show signs of weakness. And so if I'm feeling this, then must be something wrong with me. But I want to take this moment to normalize that and say that it's relative to many, and everyone's going through this. Okay, so how do we take care of this, right? So what I'm going to present to you today are individual approaches to improving stress management. I'm not going to be focusing on what can be done within the hospital environments to reorganize to help alleviate the stressors that exist there. I think that's a whole nother echo project in and of itself. But there is a lot of information regarding what's being done, as I mentioned earlier, through the National Academy of Medicine and many other programs as well. But today we're going to talk about what you can control and how you can manage those things. So what we call, as I mentioned, we've developed these master skills, these things that we would like, everybody to really embark upon. The first area is mindset, and that's really taking into consideration your thoughts and feelings. We call the second one state of being, which is really taking a look at one's management of feelings and emotion and distress. The third is social being, which is social interactions and how we relate to others. And the fourth is really putting into place really concrete stress management techniques. Okay, so taking a look at this, we see the first for mindset. There are two different types of mindsets. There's fixed and there's growth. And what you really want to encourage is a mindset that's focused on growth. And that would come from really beginning to understand your own thoughts and feelings, to better understand your own positive and negative feelings without judgment, to be able to master controlled and limited empathy. And again, this is specific to the healthcare environment. And monitor and control over identification, specifically with patients. Now, what I'm not saying is that don't be empathetic and don't be compassionate for your patient, but recognizing that your patient's stress is not your own, that you have your own bag of worries to carry around, that you're there as a vessel to help along with their well-being and get them better. So you can be empathetic, but it requires some boundary setting. And also cultivating that flexible thinking. The second part is knowing the physical signs of emotional deterioration. So often when we're so up in our heads about things and busy doing things, we don't really realize that we're under stress, right? And it usually shows itself in ways what we call HALT in mental health. It's being hungry, angry, lonely, and tired. So those physical manifestations of stress start to manifest in that way. So those were things that would be good to pay attention to. And lastly, under mindset is really paying attention to your spirituality, your background. Lean into your faith, religion, or higher power, or the beliefs that motivate you and keep you hopeful, because these are the important components to developing your health and well-being. The second area is the state of being. Again, this is related to practice of distress tolerance, learning how to manage those distressing circumstances. So what's really key here, and what we've been trying to reiterate to our students in our outreach with like our newsletters and things like that, and the students that we work with, is you need to identify what you can control and what you can't control. And again, it goes back to that healthcare environment. There's a lot about what people feel that they don't have control over. So identify what you can, and it may be something simple, such as establishing your own routine, and we'll get to that in a moment. But practicing radical acceptance is another area, that I don't have to like what's going on right now in this world, and it's very stressful, but I'm going to have to accept that that's what's going on. I don't have access to go about freely and see the people that I want to see and go to the stores I want to go to and do all the things that I want to do. Practicing grounding techniques can be really helpful. Doing deep breathing exercises. I call it scrunching your toes. If you've ever seen Die Hard, you see Bruce Willis doing that. He's called fists with toes. And, you know, or using a stress ball or fidget or cold water. I'm practicing grounding skills right now with my little Easter egg. So you can see that I'm putting that into place. So second is problem solving. So in the, you know, when you're working in a hospital, often you're working in teams and as groups, and defining the structure and boundaries of in the work environment is going to be important. Changing up work tasks often when working as that team, so that no one's stuck with a certain more stressful position that you're rotating through and people can have some reprieve. Being clear about roles and responsibilities so that everybody knows what they're supposed to be doing. Change the work or location, so if you can escape for a moment and just do something different but be productive, just changing that environment can be really important. Lastly, change work areas and locations if possible. I already said that, but expect and seek, accept, and peer support. And that's really important. We're seeing a lot of hospital systems really paying attention to the importance of team peer support and how that can be involved. The other area is establishing a routine, which is really important. There's a resource that I will give you later, which is a link to I think he's called the Happy Doctor. And he talks about the importance of establishing a daily routine, that you put in the critical things that you know you want to accomplish each day. You sit with your family or your loved ones and say, this is what I want to do each week. You set that, you take a photograph of it, and you stick to it and maintain those boundaries. That's what you have control over. And it may be silly. You know, it may be just simply my routine is to get up, get that cup of coffee, and, you know, read in the morning or what have you. That's setting the tone. You have control over that before you get into chaos, right? And allowing for small breaks. The other area is positive self-talk. So really working on those positive affirmations, that what I'm doing doesn't feel like sometimes I'm making a difference, but I am. If I weren't here, it'd be very different, that everybody's making a difference in the role that they're playing. Practice of gratitude, recognizing right now when we see so many things, so many points of freedom being taken away, it's really hard to be feeling gratitude, but feeling that, you know, good that we have what we have. If we have our loved ones around us, or we have shelter and food, those things are really important, or somebody that shows that they care for us. Stress inoculate your day, accept the things that you cannot change. I'm sure you've heard that before. And it's expecting, like, when you go into this is what you know is going to happen. So why beat your head against the brick wall, and just know that this is what it is. I don't like it. I accept it. Doesn't mean I have to like it. But you're learning those skills to work through it. The other area is that social being. So that's really important. Now we're kind of working on limited ways in which to connect with others, right? We'd say, go be with your people. And I can't tell you how often I've talked with students recently. It's like, well, I don't have my people around me. It's through virtual conversation like we're having today. But that's still really important, even though it's a different way, right? We can't go and hang out with them in their houses, but we can still schedule time to socialize COVID-19 style. So being creative about that. Sharing experiences, opening up for those that you can trust, really sharing and talking about your thoughts and feelings is really important to get it out from the inside of you, to get it out of you. Otherwise, it will manifest and start to break down your body and your well-being. The other area of good social interconnection is assertive communication, and also healthy boundary setting. So at this point, when you're feeling really stressed, you want to surround yourself with people who really lift you up, and really limit exposure to people who do not respect your boundaries. Now, I get that with family. You can pick your friends, but you can't pick family or those loved ones around you. So, but just practicing limitations there. Okay, so then we get into stress management techniques. And a lot of what I'm sharing with you is really common knowledge, but I think we very quickly forget about these things. But they're so very important to incorporate it into your daily schedule. Remember how I talked about kind of setting that schedule, putting in what you want to fit in? If you don't make that a priority, it is not going to happen. And pretty soon you're going to bowl right over it. I've had firsthand experience of doing that. I coached on this on a regular basis, and I don't know how many times I just rolled right over my lunch break, and didn't do those things for myself. And then I started noticing the irritability, the anger, the frustration. Anybody working around me would notice that things weren't working so swimmingly. So that was my cue. I need to go running or walk or get outside or do something that just to take a step away. So daily exercise is what I tell the students that I work with is a really good component in cutting down that significant anxiety and depression. So whatever form is appropriate to you, and what you can do. The other area is meditation, prayer, deep breathing exercises, the grounding techniques I shared with you earlier, progressive muscle relaxation, and yoga. There are so many ways in which you can access these things now, and I will show you those resources later on how you can really get into the practice of these things. These, when I've talked about this, the activation of the sympathetic nervous system, and when you're in fight or flight, well, the parasympathetic nervous system is what brings things back down to level. And that's what meditation, deep breathing, and progressive muscle relaxation, those areas of other mindfulness exercises have been shown to do, is to bring you back to that rest and digest area. So there's a lot of research surrounding that, the benefits of practicing those things. And one thing I want to, I'll get to it in just a moment, and I'll finish up here. But the other areas that you could get involved in is art, crafts, therapeutic coloring, Sudoku, word search, music, journaling. Again, these are things you've heard of before. You probably passed over them. You've seen them a million times. But those things can be really fill your soul when you feel like you don't have other things accessible to you. When I remember I was not homebound, not like we are now, but I had a kiddo home from surgery years ago. I'd always been intimidated by origami. And the one thing that my child wanted to do was origami, because somebody, not me, gave her an origami kit for her birthday. And she wanted to do the hardest origami thing in the book. And I'm like, oh my gosh. But when I accepted the circumstances and I realized that this is what we have all day to do this, it became something that was really impactful. Now, as I mentioned these things, these are part of personal life, but there's some things that you can sneak into your practice at the workplace. So really just being mindful of doing origami at work. Maybe you can keep your hand busy, but eating well, eating well is really important to stay well. And then finally, low caffeine, and no alcohol, tobacco, recreational drugs. That's going to help reduce and give you the best chance to lay that platform. So again, I feel like I haven't really told you new things that you were not already aware of, but it comes down to basics. I feel like a lot about what I do as a mental health professional is just reminding people that it comes down to basics. It's putting it into practice. And one of the cautions that I have is that there's so much about, we can get into what Dr. Drummond calls is the comprehension trap. I know that's what I need to do. I just don't practice it. And that happens all too often with healthcare professionals. And the second thing that tends to happen is Einstein's definition of insanity, doing the same thing over and over again without, while expecting different results. So if you don't do these are the things that you can control. And it may not be at the level or accessible to you, especially as we're navigating heightened areas of stress and crisis in our nation. But there are small things that you can do, like me and my little mindfulness egg, that you can help ground you through the day to navigate that. And when you get home, you can put these other things into practice and making that a priority. So lastly, I'm sharing with you some quick links for self-care. I believe my slides are going to be shared with you. Greater Good with Berkeley has a wonderful website on mindfulness. The Osmosis group shared some really great links for healthcare professionals. It's listed with podcasts and things. There is a program from Palouse Mindfulness that's free, that develops a program for mindfulness training and meditation. There's self-help programming available through CCI Health. And I list some other things there that are just relative specifically to coronavirus and CDC. Some general apps that can be helpful for self-care. This is just a small representation. Are things like Headspace. A lot of our students use this to help remind them of meditation. Calm has meditation and deep breathing. These are just a few varieties. I focus in on Calm because my buddy LeBron James, I think, is promoting that now. Okay. So resources for healthcare providers. Again, I try to list these according to the programs that they have because there's a lot of good information out there. So I put out the links, and it's not exhaustive. So as soon as you get on there, you're just probably going to take a deep dive into these resources, but they can be really helpful. It comes from the American College of Physicians, the National Academy of Medicine I've mentioned earlier, the formal report on clinician burnout, the American Foundation for Suicide Prevention, pharmacists, the American Society of Hospital Pharmacists, and what have you, SAMHSA and CDC. So these are all really great tools to put into practice. So I think at this point, I just want to make my final comment. Really focus in on what can fill up your cup. And the things that can fill you up are going to come from the physical areas of your life, taking care of your body through exercise and food, the emotional, nurturing those healthy relationships that you have, and also the spiritual aspects, things that drive you forward and motivate you to get through the day. So fill those cups up with those things and find what is tailored to you and what your needs are. All right.
Thank you so much, Jen. That was a fantastic presentation. I want to give a moment for our other panelists to be able to chime in and maybe ask a question or say anything very specific as a follow-up or in addition before we get into the questions that have started to come in through the chat box.
This is Sarah. I just wanted to chime in with some of the those apps that Jen had identified. At least for Headspace, I know the concern is about a lot of the healthcare professionals that are on the front lines. If an individual has a national provider number, an MPI number, all of the materials of Headspace are available for free for them during that time. So you can actually go to the app or to their website to be able to unlock. They have a free version that's a little bit smaller, but that'll unlock that for all of those individuals. So I just wanted to make sure that everyone was aware.
Thank you.
And hi, this is Doug. So I just want to comment. Number one, wonderful presentation. Thank you very much for that. I think that's helpful for everybody. And I see people in the chat are asking for getting the slides, and that's already been sent out how that's going to happen. So that's wonderful. I've found with some of my patients, some of whom have been healthcare professionals, that sometimes they get a little caught up trying to figure out how to be mindful, how to turn everything off. And so one of the recommendations I've made to them and has worked better in many cases is one where you're really using your mind, but also your body. called progressive muscular relaxation, where, and I'll just mention it here real briefly because I think people can do this with no prior practice and actually immediately get benefit. And the concept here is that you sit in a comfortable position, whether that's sitting or lying, probably not standing, and you basically start with your feet and gradually work the muscle groups all the way up to your head, squeezing tightly and then releasing the muscles and letting yourself feel the blood go back into those portions that are no longer being squeezed. You'll feel the warmth. You pay attention to your breath at the same time. If you do that going up your body, most people find that even by the time they get halfway up, they're already feeling much more relaxed. And you can do this whole routine in like 2 minutes if you need to, while you're in your busy day with all the stress. So I just mentioned that as a kind of an active approach to mindfulness that sometimes works for people who have not done any practice around self-awareness and things of that nature.
Thank you, Doug. So again, I want to thank everyone. And there are a number of questions specifically about the resources, the slides. And before we jump into other questions, maybe either Jamie or Kay can unmute and give people some directions about how all of this information, the recording, the slides, and everything will be shared later.
Hi, this is Jamie. I did already send through the chat the PDF version of Jen's presentation, so you should be able to download that right now if you are signed in from a computer. Otherwise, after today's session, Kay will be working on getting our website updated, and you'll be able to access the recordings and the PowerPoint presentation from there. And that link will be sent out in the chat box as well.
Thank you, Jamie. So to get into some of the questions, the first one was, are there recommendations for those in recovery who are unable to attend some in-person meetings?
So, and I know that a little bit farther down there were, there's another link. I know a large number of AANA meetings are trying to take their meetings virtual or remotely, and they have a bunch of different options. Thank you to Tessa, who did put in the akronaa.org in online meetings. So they are trying to be as flexible as possible at looking at different avenues to be able to still continue to support that group. And there also was a post a little bit farther down. I'm trying to multitask and screen through them. That has, so Cynthia, thank you, Cynthia Keener. There's a bunch of online and Zoom meetings through another website, and the Hope Recovery Community, the link there to that Facebook page also has, that's through, I believe, Medina, and they have a number of resources that are there as well. So really encouraging the patients to look to network and be able to connect that way. So they really are trying to support that community. May not be quite the same as being in person, but better than being totally isolated. Doug, I don't know if you have other resources that you're aware of.
Yes, so I'm going to jump also to the families of those individuals. So NAMI has launched some ability to do this virtually as well, so that not only can your loved ones get help, but you can also get help if you're, and of course that you may be in a double bind situation where you're a provider of healthcare, which is kind of the focus of today, but you're also taking care of loved ones that may have particular stresses or illnesses and so forth. So that NAMI may also be helpful in that respect.
Thank you, Doug. So the next question is, it's a bit of a, there's several questions within it. So I'm going to read them first all at once and then one at a time. So I'm seeing reports of hospitals running out of personal protective equipment, providers feeling unsafe and even resigning from their positions in some highly affected hospitals. So how would any of you recommend that health professionals advocate for themselves and their colleagues for safety during this COVID pandemic? I guess we'll stop there, and then I'll ask the second two pieces.
Well, let me comment on what I know from Department of Health, Public Health, CDC, and the World Health Organization, because I'm having a hard time not getting information overload from between the two hats I wear. But the bottom line is that although there is a shortage, part of the shortage is there's a misunderstanding about who should be wearing masks. What World Health Organization, they actually made a big push yesterday with more videos they sent out. What they're really saying, and the others, they're matching what health departments and CDC and stuff are saying. What they're saying is that if you are a healthcare provider and you are in direct contact with people who may have COVID-19, that's the time you ought to be wearing a mask. If you are out and about in the public, and this is where some of the shortage is coming from, if you're out and about in the public and you're going to Walmart and you're wearing a mask to Walmart, that is useless. And in fact, most people are probably more likely to infect themselves, because if you're not used to wearing a mask like a healthcare professional, you start touching your face more, adjusting the mask, and you've just touched all the things in Walmart, or I'm just using Walmart as an example since they're actually open. So that's a problem, because that's where part of the shortage is that we have a bit of a hysteria in the public about using it. In reality, the only people in the public who ought to be wearing masks are those that have the illness. They should be putting the mask on so they prevent droplet spread to other people that are out in the community. As far as actually advocating for the healthcare workers, that's really happening at a big level, whether that's at the White House or our local public health, for example. I know that Donna Skota, who's doing an amazing job running the Summit County Public Health Department, she is constantly embattled with trying to get more and more of the correct types of masks and so forth to protect the healthcare workers. And that is starting to move a little bit better at this point. So I actually think we're going to see more of those flooding the market, and particularly in the healthcare setting. So as much as people are nervous, I think that is going to get better. They've also just put out ways that you can sanitize a mask. So if you're a healthcare provider, you can reuse the mask, whereas historically you wouldn't do that. They've got ways you can do that are on the web. I'll to find the resources for that, but I've seen it. And that also should help to be able to not have the shortage, because I understand the fear if you're in that setting. But I think that the idea here is to come up with the best way to actually have the personal protective equipment, PPE. You'll see that thrown out there, which mostly means masks and gloves and gowns in some settings. The other thing, as I'll mention, some creativity is occurring. So on the gown side, one of our, actually it's through the Developmental Disabilities Board in Summit County, and Public Health then loved this idea once they heard it. They've been buying rain ponchos and using them in place of gowns for staff in the settings where they have individuals with intellectual and developmental disabilities. There may be less likelihood you'll get those individuals to be careful about washing their hands, not sneezing on you, that kind of stuff. So they're using this, and again, there's creativity that can be used to help for some of this.
Thank you. One other thing that's
oh no, go ahead.
I just wanted to add one other thing, because there was a question about CBT that was in there. I think that especially for individuals who are on the front lines that may really be having to deal with this anxiety on a regular basis, whether it's during what they're doing every day or when they come home and potentially infecting someone there, is that self-evaluation that Jen was talking about, as well as trying to identify when things really start to get out of control. I mean, recognizing some of the input that they're getting from news and other sources really can make that overwhelming. So some of those techniques could be really helpful at this point.
So there's two additional pieces to this question. And in addition to our three panelists, if Dr. Zarconi, who is our NEOMED's medical director for COVID-19, has any input that he would like to share, Dr. Zarconi, you're also welcome to unmute yourself and chime in. The second pieces of the question are, what are the best avenues within the administrative structure of each organization to advocate for and protect staff? And what about with lawmakers?
So thank you for inviting me to the discussion. Actually, I think that at NEOMED, there's been a good example of how to support folks by through the organization by continuing to encourage all members of the organization to keep in touch with the people that matter to them, to get outside and breathe some fresh air, to practice some of the things that you heard Dr. Dougall talking about. You know, I made the comment to a reporter recently that I think it's unfortunate that we're using this term social distancing because I think that's the last thing we should be doing during this. I think what we're really talking about, what we should be calling it, is physical distancing while sustaining social connectedness. But that's probably a longer phrase than everybody wants to use. But I think the point I'm trying to make is that as this continues to get intensified, it's really going to be increasingly important that we do whatever we can to not be isolated socially while we isolate ourselves physically. And so I think the best guidance that we can all give to members of our team is to make sure that they are sustaining the social connections that matter to them, and that, as I talk to students about all the time, that help fill our tanks back up when our tanks are running on empty. So I think that's what I would add to the discussion.
Thank you very much. So we have another question from Laura Barr. She works for an organization that has residential counseling program for Amish clients. They're finishing a group that was here before the pandemic hit and looking to the future for when and how to ramp up again. Does anyone have residential treatment recommendations on how to safely admit clients?
Well, I can start. We've had this discussion multiple times, but as recently as yesterday, Monday, with Summit County Public Health. And again, they're getting information through Department of Health and so on. So what they're doing in our things, and ours are actually a rotating group of people. So it's not a static group that gets treated and then we shift to a new group. So they're actually doing this on an ongoing basis. What they've been doing is, for the most part, is relying on temperature checks. So they do ask the usual questions. At this point, questions about travel are mostly moot because there's no place to go, to travel to. But they do ask questions about that. So they have a screener of that type. They screen for the basic symptoms, other than fever. Cough is the most common. But they've even seen a few cases now through public health that have mostly gastrointestinal symptoms. So we're trying to be detailed in how they do the screenings. They do the temperature check. At that point, they're just a little more vigilant with the new admissions to see how they progress. And they have the ability at times, not always, depends on how full they are, to put somebody who isn't screening positive but thinks they were exposed, and they don't know for sure because there aren't enough testing kits out there. Then they'll put them in a single bedroom, for example. So at least while that we see whether they present as having illness. So far, they've not had anybody, by the way, convert into having symptoms. Therefore, we don't know there's illness. But those are the basic things they're doing. I am happy to see if there's I've not seen one, but a document that we can then share, at least with you, Dr. Barr, and maybe others if they're interested, if there's something that's been officially codified, and maybe not yet because the final discussion really just happened 2 days ago. But if that does get created, I can certainly get that for you.
I have one question, please. How do we manage ourselves if there are people that are asymptomatic? That is a concern, and I know they say don't wear masks, but we see around the world that's what they're doing to protect themselves. So that sort of is confusing to me.
I think
I'm sorry, go ahead.
and then I'll just jump forward. You are correct that there's a lot of confusion around this. And I think that's why the World Health Organization just started pushing harder on when and who to wear masks, because it's just, we're hearing everything under the sun. But the World Health Organization, of course, is looking at all of the countries, including China where this started, then South Korea and some other locations. So I think their recommendations are the best ones to use, as well as, and I agree with Dr. Zarconi, physical distancing. So at least that 6-foot barrier between you and the other person, mainly so the droplets can't reach you nearly as easily, because the droplets do occur just by speaking. So they're trying to prevent that, that type of a spread. And Dr. Zarconi's got more, I think.
Yeah, I was just gonna comment on this whole mask controversy. In fact, it's sort of timely because my wife and I have been arguing pretty vociferously over the last couple of days about this, and which is an unhealthy way of coping with the COVID virus, by the way. But there really is no compelling evidence that if you go out in public and you come into contact with an asymptomatic infected person, that if you are wearing a standard mask, the likelihood of contracting that virus from that person is less with the mask than without. And in fact, there's some evidence that it may be higher. The asymptomatic person who is infected is generally, if they're asymptomatic, that means they're generally not coughing, sneezing, or whatever. So the way to contract it from an asymptomatic person is through physical touch. And the mask doesn't influence that, in fact. And so there's no evidence that if I wear a mask that I'm any less likely to get a common cold from somebody around me. And so far, there doesn't appear to be any evidence of that with the coronavirus. I think what some of these other nations have succumbed to is that they've gotten to such a level of tension and concern about this pandemic, and rightfully so, given their experience, that they're doing whatever they feel they can to, if nothing else, feel like they're protecting themselves. But just 2 days ago, the World Health Organization was asked again, and they continue to say that wearing masks in public doesn't reduce your likelihood of getting the infection from asymptomatic people who may be carrying the virus. And the other issue is an ethical one. To the extent that we all wear masks, we're pulling masks from the healthcare provider pool of masks that where those might be increasingly needed, particularly if we run out of N95 masks and the capacity begins to exceed our ability to serve. So the mask question, but the answer to the question is, how do you manage yourself to mitigate risk around asymptomatic infected individuals? And I think that all goes back to the standard aseptic practices of frequent hand washing, a physical distance of greater than 6 feet. And I think so we have we've started doing a few neighborhood social distancing gatherings where we gather with strict rules. We have to sit at least 7 feet apart from each other. We don't touch anything that belongs to anyone other than ourselves. So if you're going to bring something to drink, you bring your own cup. If you do happen to touch something to somebody else, there's Clorox wipes and Purell, and you immediately do hand cleansing. And so I think it's best to operate on the assumption that everyone you come into contact with is potentially infected. And so keep your distance, wash your hands if you come into contact with anything that belongs to that individual. But so far, there's still no compelling evidence that wearing a standard mask, which is open architecture and doesn't defend the face very well, is of any value. And as I said, the other thing that masks do is masks bring our hands to our face because we're always tweaking and adjusting, squeezing the mask. And so if we've come into contact with virus particles, and then we're messing with the mask's very presence on our face may have increased the likelihood that we put that virus someplace where it's going to enter our system.
Right, related to that question, maybe, how do you know how we're doing regarding contract tracing in our county? And by our county, I'm assuming we would be looking at Portage and Summit in general, or do you have resources on how people could find that out for their specific county?
My understanding is that the medical providers are required to notify both the infection control folks at their local facility and their local health department of anyone that's either under suspicion for COVID-19 infection or documented to be COVID-19 infected. The health departments are, as my understanding is, the health departments are initiating the contact tracing. So they intervene with the individual in question, and then they gather a history about potential contacts, and then they reach out and they do the contact tracing and advising about quarantine or seeking medical attention or whatever, depending on the circumstances of those contacts. What we've been doing at NEOMED when we've been alerted is we've also been notifying who we understand to be contacts and advising them to anticipate contact from the local health department. But that's my understanding of how that's working, Nicole.
Thank you. So, and the next question that we had is, could someone discuss the positive, negative effects of social media during this time on mental health?
Yes, I'm so glad you asked that question because I realize I kind of really glazed over that pretty quickly. It's probably in my presentation, but I forgot to mention it. And one of the key things that can help reduce stress is, I think, limiting your media, the contact with media coverage regarding COVID-19. Because we have to keep some kind of level of, years ago, I'm going to go into an example of concerns versus worries. I had a dear friend of mine in college who came from a family where there was political disruption or what have you. His father was imprisoned as a political prisoner from Malawi. And he told me the story of how we have to focus in on what we can have concerns and what are worries, and making the difference between those two. That we have to really differentiate between the things that we need to be concerned about. So that goes with the masks and the concern regarding wearing that or not wearing it, striking the middle distance about where that is versus things that are really getting beyond what we have control over. So taking, going the middle line, as my mom used to say, is just too much of anything is bad for you, right? If we all panic and worry about having any kind of contact, then we're going to remove ourselves from those things that could be really beneficial for us. So we have to find some kind of middle ground. So, media, it goes back to being a concern. We do need to know if we, can't leave our homes, or we, grocery store accessibility, taking those primary precautions and protecting those who are most vulnerable. Those are concerns. But when we look at a lot of what we don't know, those become worries, where if we exacerbate this fear to the point that it makes us not want to do anything, or we're exposing ourselves only to those negative stimuli through social media and the panic that stirs about, then it's going to start to move from there. So have facts to support that, go the middle line, and figure out what's reasonable to you. So in some ways you want social media to have connections with people, but if it's causing you panic because everybody's talking about something that's really upsetting, go from there. The other day we had somebody's interpretation of the governor's speech. It was completely different than what others of us had. So it set some of us into panic, and some of us were like, wait, my husband's like, I didn't hear that, And so, we just really just people can take those takeaways. So just guard yourself from that. And that goes along with those cognitive behavioral principles of cognitive distortions, making sure that you're working through challenging that thinking and those overgeneralizations.
Thank you so much. So I have two questions that are pretty related. I'll go to this one first. Are there suggestions for how providers can help other providers during this time?
Sure. So one that I think is actually very positive is, and again, you could do this with physical distancing, is to perhaps, buddy up with one or two other providers and agree to check in on each other to see how they're doing in terms of coping and emotional stress. So they could be people you're already friends with, or they might be colleagues working in the same settings, so you're dealing with the same stressors, and that idea will keep that strong social connection. We are social animals, so we really do need that social connection. And yet you could obviously do it between healthcare providers. You'll at least understand you need to do that 6 feet, or I like the added foot there, 7 feet for Dr. Zarconi's location, because you're trying to create enough distance that everybody can feel safe, but that connection of buddying up can help you to talk more candidly than maybe you otherwise would have prior to this kind of a pandemic.
Thank you, Doug. And I will echo what was put into the chat by the Echo Tech. You can always join Echo programs and stay connected through those. Those are weekly. As a follow-up question though, what are some types of interactions that are meaningful to help alleviate stress for our patient-centric professionals? And then what can admin and finance health professionals do to help those that are on the front lines?
I think to piggyback off what Doug just said, just the check-in. So there may be the impression that individuals feel like they're out on their own. So even you may not be able to alleviate all of the anxiety that they're experiencing, but just to reach out and say, hey, I've been thinking of you, how are things going, to establish that social connection. And you know what, if they're too busy to respond, that's totally fine, and not being upset about that, because maybe they are juggling a whole bunch of things. As you saw, I have my kids here. They were answering the door here earlier. So recognizing that they may have a lot of competing demands. I think one of the other pieces that's really important is to check in. So if you see someone who's struggling, what is it that you see, and kind of reaching out, hey, you know, it looks like you've got a lot of stuff going on. What can I do to help you? Recognizing that the answer is going to be different for most of the individuals, but I think establishing that you're there and that you're trying to be supportive of them really are going to be the things that are most important. There's not going to be a one size fits all piece that'll help all of them in general.
And Nicole, I was going to add for the second part of your question was admin and finance, but I think by that question is implied, what about the back office folks who aren't at the patient battlefront? And I think in what I've seen beginning to happen in a lot of organizations, and also frankly in our government, is that what I think those individuals can do is to look for ways to make the work of the providers easier. So often in these organizations, there are policies and procedures, for example, that if during a pandemic are going to continue to be enforced, will make life even more difficult. And so are there opportunities to relax policies and procedures that at least for a few months won't matter that much, and might make it a little easier to do the work of caring for the sick? And I think you're seeing some of that in terms of relaxation of HR policies and changes in HR policies in some organizations. And so any way that back office function folks can look around the organization and figure out how to remove impediments and obstacles to efficiency and getting the work of caring for the sick done is heroic, frankly.
I absolutely agree. And it's not a question, but a comment was put in a bit earlier in the session that I think speaks to everything that we're talking about right now, is that it's good to be reminded of things, but we have to make sure that we're operationalizing this so that we actually have things we're putting into practice to practice our own self-care and check in on others. It looks like we don't have any additional questions unless I've missed one. So please, feel free. What are your questions, your comments? Does anybody have some personal, a personal perspective that they'd really like to share with others on how you are coping with all the stress since this hit?
Nicole, this is Joe Zarconi again. I have a question that I would like the mental health professionals with us to comment on, because it's an emerging scenario that is beginning to get talked about in healthcare circles. And it's the scenario that is becoming increasingly common of a person who develops this virus, is hospitalized and potentially dying, and doing so wholly alone, with family members who are structurally isolated from them. My wife and I have an acquaintance from the neighborhood whose father recently was hospitalized for 3 days and then died. And now her mother is hospitalized and actively dying. And for all of that, she has had to stay at home. So she's about to lose her both parents, and both parents will have died alone, and she will have endured not having been with them. The issue around the caregiver experience in that scenario has become very public of late, and we've all, I'm sure you've all started to see videos on news coverage of providers, physicians, nurses crying while they're telling the story about they were at a person's bedside and FaceTimed with the son so they could say their goodbyes, and describing how gut-wrenching that was for them as a nurse or a physician. The most haunting one was recently I watched a nurse look into the screen of her cell phone and say, "I will be there for your father." I can't imagine how a healthcare provider can endure that kind of scenario, but I think we would all be wise to advise our family members, particularly our distant family members, to prepare for those kinds of scenarios. So I'd be interested in the mental health professional comments on how do we hold healthcare practitioners up in that kind of an environment.
Thank you for bringing that up. I think I think we're going to start seeing that all too often. And I think that's going to be something that our healthcare professionals are going to be confronted on a more regular basis. And it speaks to that secondary traumatic stress that our healthcare professionals cope with. And I think that's what's really important, is to recognize that we can be there for those important moments. But I think what often comes with healthcare professionals or family members too, who feel like they're separated for their loved ones, is guilt, right? That we can't be there, we're limited. And it goes down to, controlling what you do have control over. Putting those things into practice and recognizing that I can be here for this person and I can be here for those moments, and I help these families connect. But this loss is not my loss. And that's keeping that somewhat, that distant empathy, that there is an empathetic, I'm responding to it and helping someone along, but also stepping away and not getting too consumed by it. Because that's the nail that drives the coffin for so many of us in healthcare professions, right? Being consumed by those moments in our patient care. It's what makes us compassionate to do what we want to do, what we have set out to do to help others, but we have to also manage and recognize those boundaries and where that's at. And, it's easier said than done, for sure. But recognizing that we can only do what's within our own power and doing the best that we can. And it comes to that point of adaptation and acceptance of, this is not how I wanted it for my loved one or this patient, but I'm doing the best that's available to them. And then taking that time, if you're a healthcare professional or family member dealing with that, to be able to mourn that and take that loss and have that time to grieve.
And I just want to draw your attention, Radessa had put in the chat, also encouraging them to seek out teletherapy, both for the survivor guilt and then potentially for the PTSD that's going to come long term. So it's going to be ensuring that we have those supports and we're checking on those folks, not just now, not just at the end of the month or in May, but in the months going down the line, because they may be able to deal with it now, but may start struggling with it as they get a little bit farther down when this hopefully resolves.
And I'll just add to that, I think that in many of the, at least hospital settings, they do have mental health departments. And although a lot of them are trying to do telehealth, I'm sure they could work out a way, if needed, to do a 6 or 7 foot physical distancing and actually do a face-to-face discussion, so you can give support to your colleagues that are providing healthcare and having that stuff work. As you, Dr. Zarcone, you self-disclosed about your neighborhood. I mean, my family's going through this as we speak, in that my 86-year-old uncle just passed away in Arizona, not from COVID, from a long-term cancer. So a lot of grieving's been done. But unfortunately, my aunt, who's in her 70s, is on her own, and nobody can get to her. And so we've been talking and stuff a lot. But you're right, it's a very tough situation when you can't do the normal process of grieving. In effect, she set it up. I told her I'd find a way to get out there if need be. She said, no, we're going to do a memorial service later when we can all get together. And for now, we're just going to talk a lot. But so you're right that even in families that are dealing with that situation, and then we're trying to figure out how do we help not only those families, but how do we help our colleagues? I think we really need the systems to allow the mental health professionals to step up and do that, because I don't think that happens as quite quickly and as common as we'd like normally. So here's another place we might need to relax a barrier to help. And I'll just put one other plug in, especially for those of you who do anything with administration across healthcare systems. I think these relaxed rules and laws and standards, we really ought to be tracking which of them has caused no harm and has actually been really helpful. Because I'm not convinced that we should go back to business as usual just because we wiped the virus out and go back to all the restrictive rules and stuff we had. There may be some we can, you know what, we could leave that one less restrictive and actually continue to help more people as we go forward. Just put that other plug in for kind of monitoring what's going on now and seeing if there's places that we might discover some benefits that come out of this for the long haul.
A related comment that was put into the chat box was to check with your local mental health and substance use disorder boards or local ADAMS boards, noting that Lake County has set up a virtual support group for first responders and frontline workers. They also set up the ability to have 3 private therapy sessions free of charge until you can get into a private therapist or EAP program. So that's a fantastic resource. There's a question also about, do you have any suggestions for helping move our coworkers along if they're stuck in a pattern of negativity and cognitive distortions? And obviously we can't be our colleagues' therapists, but are there simple tips that we can use to kind of help that process?
I think it's setting the stage to be able to really recognize I think normalize that everybody's going through difficult circumstances, that no one's exempt from this process, right? And that it's okay to feel those feelings of frustration, anger at times, feeling disheartened, or maybe a joy when something does work through. It's very complicated. It just goes through that whole process of grief and loss and all those complicated emotions. And so I guess, what we say in mental health, validate, right? Validate that experience. That must be really frustrating for you. I know we don't have the proper equipment, or we can't do exactly how we would like to do this for the patient. But we are doing the best that we can. So it's doing that, validate and change. So change the perspective. Let's look at it from this other angle and look at, the things that we can be grateful for. Hey, we have a great team. We don't have all the tools in place that we need, but we know we can look out for each other, and just emphasizing those aspects. And so that's just that way that person doesn't feel like their experience is not normal, that everybody else is just bootstrapping it and doing fine. But it's just giving an opportunity to normalize it, say it's okay. But if it becomes to be so intense, then it's having that private conversation with someone, just saying, hey, again, validating the feelings. Let's work on what we can change. Let's look at how and see how we can adapt to these circumstances, because it's not going to change anytime soon, and just creating those blockades. So it's a careful process, because everybody's not coping in their best of ways, and redirecting and moving along.
And that negativity can be contagious. So if you find that maybe that's starting to color the way you're looking at things, I'm going to there's a couple additional apps that were in the presentation that address this specifically. So one is called Mood Fit, and it's almost like a challenge for the way that you approach something. So, yep, that sucked. My dad just started another round of chemotherapy, and he is distant. My mom is a nurse practitioner, so there's definitely that fear, Dr. Zarconi, of what happens if she brings something home to him, recognizing I'm not going to be able to get home for that. But yes, that sucks. So what can we do in the meantime? How are we going to address this? So being able to challenge yourself to the mood that you take, or address and affirm the emotions that you have. You know what, that does suck. There's nothing you're going to be able to do about that. But how do we continue to get the other things done? The other is Mood Mission, which actually sets you up on different missions with some cognitive behavioral therapy type skills, not a specific CBT program, but that can really help you start to look at, okay, how do we get down this path? If it's catastrophic thinking or something like that, that may be helpful. And then if it's helpful for you, that could be something you share with some of your colleagues who seem to be going down that similar path.
Thank you very much, Sarah. We've had 2 additional questions. One that I want to get to, because I know we have a number of medical students and possibly even other students on these sessions, but is there any word on which residency programs are calling interns to start early, any besides internal medicine?
I've not been in the loop on that, so I unfortunately have not heard.
Okay. An additional question is, are there areas where there are active lockdowns and the mortality, okay, sorry, I'm trying to read this on the smaller screen. In areas where there are active lockdowns, the mortality rate is quite high at specific healthcare facilities. How are family members of deceased patients being notified, and any support initiatives to help with the notification? Unfortunately, it seems like we might not know.
Yeah, I'm not aware.
That is unfortunate. There is a comment in the box, and Jasmine, why don't you go ahead and unmute yourself and tell us what this story is rather than just me reading it.
Hey everyone. Yeah, so actually this story is from my sister, who's a nurse tech over here in New York, in Westchester County. And she's a tech, and she just transferred to being a float, meaning she doesn't really have a home in the healthcare community now. She doesn't have a unit. She goes where she's needed. And especially in this time, she's going to COVID positive floors. And so she had taken care of a patient in the ED. The test results were pending. A few days later, she went in for her next shift, and the patient was tested COVID positive. But her principal admission was because of a psychiatric ailment. She was actively suicidal, inflicting self-harm while inpatient. And so they had to medically clear her before she went off to a psychiatric facility. So my sister was taking care of her. She was one-to-one with the patient. And the patient had tried to go into the bathroom, swallow paperwork that one of the other staff members left the patient's belongings. And so the patient was trying to swallow papers, and my sister had to physically restrain the patient. So during her break, my sister, asked the nurses and the other techs if the patient could either be physically restrained or have any kind of medical interventions to basically calm down the patient, because throughout the entire day she was just completely agitated and looking for any way to hurt herself. And the nurses were, and my sister quotes, said basically, she's been like this for the past 2 days. We don't know what to do about it, and no one else wants to go in there. Kind of you're new to the unit, so you go and handle it. And so my sister called me, and she was just completely just so disappointed and felt just so alone in the process. And I just wanted to bring that up as kind of both addressing the mental health concern for the provider, for the patient, in the aspect and in the environment of the COVID crisis that we're having.
Thank you very much. I appreciate you bringing a real world example of how stressful all of this is right now, particularly in units that would tend to be high stress anyway. Psychiatric units are high stress, and when working with a person who is actively not well is definitely a high stress environment. But to be new, to feel unsupported, to have the additional stigma of working with a patient that has COVID, I really appreciate you sharing this with us. And there's a lot to unpack there. Thoughts, questions, comments from our panelists?
So first, I'll just say I agree that's not good care. The individual approach is the opposite of the social connection that we're trying to maintain outside and inside our work settings. You know, a one-to-one means somebody ordered it, so that's got to be a physician that ordered it, maybe even a psychiatrist. So this may be another situation where healthcare professionals, whatever their role, need to relax another rule as far as going through the hierarchy. So if she's tried to talk to other nurses and other techs, she probably needs to take it up a notch to either like a director of nursing or a physician, whoever he or she is that's in charge, and say, look, I need a team approach here, and I'm not getting that. I think that will help, because this is probably a symptom of everything falling apart for the whole team. It's not just this one case. So I would think that this is the learning point for the team, which will then support everybody, including the tech in this case.
Thank you.
Yeah, absolutely. Thank you very much. As we're getting close to the half-hour mark, I do want to remind everyone that we do have a survey that we'd like your feedback and your input about this session. So please do complete that survey. It's in the chat box. It very well may be emailed also. I will let one of our coordinators speak to that, because they can do that better than I can. But I really want to thank all of you for being here, for joining us, for having your cameras on, for your input and your questions and your participation throughout, and for really supporting one another. If there's anything that I've learned in doing Project Echo over the last several years, it's that it can create community, and we need things like this, and to be able to connect to one another and to do good for our own mental health. Doing Project Echo sessions is good for my mental health, so I hope that it's good for everybody else's too.
And I'll just take that a quick step further, because I think a couple of you have commented, you've noticed I changed my background again. I think, you know, you need to find the things that you like to do, you enjoy, and amplify those some when you've got the time. So for example, last evening, probably later than I should have been up, I was searching for backgrounds to try to switch on Zoom, because I'm in a lot of Zoom meetings, as you all are probably, as well as join.me, which we're using in the ADM system and so forth. So I think there's fun, and you can use it to remind yourself. Here, Dr. Dougall is doing the same thing. That's awesome. You can use it to remind yourself of positive things you've been through. So I'm going to take myself out of the picture for a second. So I'll just show you, these are Galapagos turtles. I went to the Galapagos Islands last summer when I was allowed to travel. So, you know, something to remind you of a positive thing you've done would be to see something like, oh, wow, I remember those turtles. And there were a lot more than 2 of them, if you could scan the area. You know, and it's another positive approach while we're dealing with new technology and physical distancing. And again, I like that much better than social distancing. You can use other ways to connect both to your positive things that you'll get to do again at some point, as well as to this, as Nicole said, this ability to connect socially with each other.
I appreciate that. We use a lot of humor with our team in the nature of the work that we do. Sarcasm runs very rampant. I almost started my presentation today with, "Good afternoon, cats and kittens." And if you've been keeping up with Tiger King on Netflix, you would know exactly what I'm talking about. but anyway, it's just finding humor in those things. And yeah, that's a good filling of the soul.
Humor and pets, whether or not you're Tiger King, pets. I know amongst our team, everybody has seen and met and heard my dogs a number of times, and I've got to see and meet everybody else's dogs, which is very cool. We normally don't get to do that. I advocate when things go back to normal, let's bring our dogs to work with us.
And in fact, everybody who logged on today, I understand, is getting a $100 Amazon gift card. Oh, April Fools.
Yeah, sorry about that. There's none of that. But any last thoughts from Sarah, Dr. Zarconi, or any of our coordinator team?
Be safe. Stay well, isolate yourselves.
Yes, stay healthy.
Yeah, just thank you guys for all taking the time today to join us for this session.